This effort to reform our nation's healthcare system is finding ways to make quality health coverage affordable and accessible to all Americans. And I believe the bill we're considering in this chamber, as it currently stands, goes a long way towards making that vision a reality. But even with this solid legislation, there's still a large group of Americans who continue to be left behind. I'm talking about our country's first Americans, the 1.9 million American Indian and Alaska Natives, who are suffering because the federal government isn't living up to its promises. The law that provides the framework under which the health care programs for Native Americans are delivered hasn't been reauthorized for more than 10 years. This means that the Indian Health Services delivery system is chronically underfunded, and given the rapid advance of healthcare technology, outdated. As a result, too many Native Americans are struggling to receive quality, timely health care. This agency is supposed to be the principal health care provider and health advocate for Indian people. Yet every day, because we fail to act, the health care situation in Indian country grows more urgent. Native Americans are diagnosed with diabetes at almost 3 times the rate of any other ethnic group. They often don't have access to preventive care. And Native American youth are attempting and committing suicide at devastating and alarming rates. Just 2 months ago in my home state of New Mexico, a 14-year-old girl from the Mescalero Apache Reservation became the 4th young person from that tribe to take her own life in a little more than 1 month. 4 young people in 1 month on one reservation. Tell me this doesn't cry out for action. The Senate Indian Affairs Committee has reported the reauthorization bill. The House has put in its health care package the same kind of reauthorization bill. Both of these bills would bring us much-needed reforms to the Indian health care system. This legislation, the Senate must act upon it. We can no longer delay. For the past several years, Congress has failed to get this legislation across the finish line. It has passed both bodies in the last several years, the House at one point, the Senate at one point, but it is still not law. Now is the time to put this in the health care bill and get the job done. I know my colleagues on both sides of the aisle are in agreement that our nation's health care system needs reform. We know health care reform is needed now. We know the status quo is unacceptable. But what is missing is the same sense of urgency for our Native American communities. This, despite the alarming statistics from the Civil Rights Commission several years ago, that the U.S. spends more than twice the amount on a federal prisoner's health care than that of a Native American man, woman, or child. That's $3,800 per year per federal inmate versus $1,900 per year per Native American. That's right, our inmates have better health care than the population with whom we signed treaties and made a promise to provide health services. American Indian and Alaskan Natives are 3 times as likely as whites to be uninsured, and almost half of our low-income American Indians and Alaskan Natives lack health coverage. The longer we wait, the more Native Americans suffer needlessly. The longer we wait, the more Native Americans go without treatment for chronic conditions like diabetes and heart disease. The longer we wait, the more Native American teens who may take their own lives because they're not getting the help they need. America has an obligation to provide quality, accessible health care for our country's first Americans. So I say again, it's time to act on this important piece of legislation. It's time to reform the Indian healthcare system and permanently reauthorize the Indian Healthcare Improvement Act.